Hi guys, it's Steve from Arkansas again. And of course, we're going to be talking about mental health again today. And today, let's talk about some side effects. First off, let's start with side effects of medication. Okay, the medication does improve your overall life, guys. Bottom line, don't refuse to take it because it doesn't make me feel right or whatever. Your life does improve. It does improve when you're on medication. Don't use it because I don't want something controlling my life, or it's like I hate having to take medication every day. Because quite simply, you don't want to be a homeless person living on the street. You don't want to be in some jail cell. You don't want to spend the rest of your life in a mental hospital. If you don't take care of your mental health, it will finish you off. Because I have no desire to be living on the street. Just because I'm too scared, or I don't make me take my medication. I hate to take medication. It's like you have a choice. If you take your medication, you can live a somewhat normal life. And in some cases, some people actually able to get back to a normal life. If you don't take your medications, you're gonna go completely off your rocker. You'll lose all process of reality. You'll lose everything if you don't get some kind of help. You will lose your family, you will lose your friends, you will lose your house, and you'll be one of those homeless people living on the side of the street. You see them talking to themselves all the time, acting weird. That's not a choice. That's just giving up and saying, oh, I'm going to let my deteriorating mental health take control of me. Okay? Choices is trying to live a normal life, somewhat normal life, or maybe a full life, or completely losing your mind and losing all concept of reality. Easy choice to me. It's like, I want to try to live as normal life as possible. I want to be able to spend time with my kids. I want to be able to go occasionally and see my family. Okay? Now, the side effects of medication, most often, for me anyway, is constipation. Yeah, you can eat, but it's like it's painful removing it from your body. Okay? And let's just say as well, guys, if when you have depression, you have no sex drive whatsoever, men and women both. Okay? When you're on the medication, your sex drive will increase. But, guys, you might not be able to get the job done. It does affect you. It affects your whole body and your brain chemistry and everything else in your blood flow to certain parts of your body. That means you might not be able to get the job done. And in that case, thankfully, there's plenty of men's products out there that can help you if you need, or if your spouse feels the need to be able to enjoy life with them, make love to them. Okay? It does impair you, the medication, but you're already impaired anyway when you're not taking the medication. You have no drive at all. All right? Headaches. Headaches are part and parcel with mental health. You will have them while you're dizziness, lack of concentration. You can't focus on anything. But when you go on the medication, you're able to focus better, but you still will have headaches. And usually, only at first when you take them, okay? When you first start taking medication, your brain chemistry is trying to get in line, so it's going to be painful at first. But once you get through it, I've noticed over time, I'm just fine. I have no headaches. If you go off the medication for a couple of days, you'll be in such pain that it's incredible. I guess the best close is like taking any other drug. When you go off of it, it affects it. Cause your brain chemistry. Okay? So as long as you're taking it, after you've taken it for a certain period of time, usually the headaches goes away. Now you will have dizziness while you're taking the medications. You'll occasionally all of a sudden feel like the room's spinning and so forth. It happens. Not much you can do about it. Because when you mess with this, your whole life changes. But to try to live a normal life is the important thing. Trying to be your old self. I'm not where I was when I first had my nervous breakdown, but I'm a lot closer than I was. And here was when I was at my worst. There's like slight difference, ain't there? Okay, I haven't talked a whole lot about anxiety. People assume this person's freaking out and screaming it's over. No, anxiety has different levels. Anxiety, at its worst, of course, you go run off, scream, or you go completely nuts and start hitting and throwing things and so forth. There's different levels. It's like when you have anxiety, you can just start shaking just a little bit. I sweat a lot. I start yelling. And that's what anxiety medication is for, is help you control those symptoms. You will feel like you're having a heart attack at times when you're having an anxiety attack. I have felt them a couple of times. I thought I was having a heart attack. And I wound up in the hospital. Thankfully, when they realized what it was. Side effects of mental health and its medications. Weigh the risks. There's some psychiatric medications that there's your body. So make sure to ask the doctor plenty of questions. That's what they're there for. They try to leave you say, wait, doc, I got some questions to ask. If you're just going to a regular doctor, if you're going to a psychiatric doctor and they're prescribing medications, you talk to them about it and ask them, okay, what can I expect from this medication? Now, as I've said previously, the medication you're going on will sometimes make your symptoms worse. Alright? So have people monitoring you. And know it was like, this doesn't feel right. Go back to the doctor, ask them, or if you're having somebody help take care of you, thankfully, if somebody to help you, have them come up to you and talk about what you're acting like. Now, there's bipolar disorder and its side effects. Most people just assume as like all there is highs and lows. And for a long time, that's what doctors thought it was. And they've come out with a thing now, thankfully, now that they've isolated it better. Mental health is a rough thing. It's hard. As I've talked about with my different symptoms, they've labeled me and labeled me and labeled me. It's like at first it was just depression with psychosis, PTSD, borderline personality disorder, and finally psychoaffective, and my diagnosis has changed as far as I can tell. Now, with bipolar, there's a second set of symptoms. It's not just highs and lows, it's where you're depressed certain days, but then you're able to act normal. I said, and I have a relative who, she suffers from this. Most days she's very depressed and is barely able to function. But then she has days where she's actually able to get out and do things and not feel sleepy, not feel tired, not feel off, and able to live. Now, here's something else y'all need to know. Treatments for mental health. They have reintroduced shock therapy. Don't go screaming, don't assume it's like they've completely lost their minds. Electrical currents run through your brain. Sounds strange, doesn't it? But there is. It's like that's what runs from your nerves to your brain to different parts of your body. There's these electrical impulses that run through it. You may have seen some of these shows where they talk about they electrocute somebody until they completely forget what they are. To an extent, that's what works. People certain mental conditions, like I said, my relative, she had some electroshock treatment. And she noticed a difference. It did help her. Now, you do lose some parts of your memory due to it. It's very controlled. It's a controlled environment. And what they're trying to do is do a cognitive reset. I guess that's the best way to phrase it. And this can help certain people. It's not for everybody. Not everybody that will recommend it. Not everybody that recommends it will want to take it. It's a little bit dangerous, but it can help certain people, okay? So it's like if they recommend it, ask questions. Think about it for a while. Be sure it's better than the alternative to the life you're living now. Oh, let's see here. Oh, yeah. Part of the reason they have difficulty with diagnosing different people with mental health. Some people, it's very obvious, the manic depressive, the depression, the anxiety, people who are paranoid and schizo and so forth. But there's a lot of symptoms that do overlap with different mental illnesses. People who are largely depressed do have anxiety. People who have anxiety sometimes are also paranoid, and they may suffer from psychosis. There's different types of psychosis as well. Like some people you see things, or you just hear things. There's things where you can taste things, you can smell things. There's all sorts of things where it's like, at times on certain medications, I also just feel like my skin's crawling all over my body. That is a form of psychosis, and certain medications can help with this as well, and certain medications can cause this. In that case, you go to your doctor and say, I need a different medication. It's that simple. Don't say I'm not going to take any more medication at all. If the medications are not working, if their medications are making you worse, go to the doctor and talk to them about it. And they will switch your medications. Now, sometimes they'll want you to stay on it for at least a month or so long enough for it to fully get in your system. That's something to remember. The first couple of days, 3 days, so forth, after you take it, it's getting in your system. You won't notice an immediate difference. It takes time to fully get in your system, approximately a week, 2 weeks, depending on the type of medication. As I said, it's like about a month you have to be on it, and then you'll know whether or not it's working. It's like after taking a couple days, no, it's not working, I need something else, or it's like, I need just don't mess with it anymore. Take it for the prescribed time, unless you have a major reaction to it. In that case, immediately go to your doctor. And you will know a major reaction when you have it. Like I said, in one case, all of a sudden, I just had fits. My anxiety went through the roof. It was like I was constantly moving. I couldn't be still. It was just like I was chattering 90 miles a minute. And as you can tell, it was like, that's not fairly normal for me. I try to be slow, calm, talk steadily. Now, if I'm excited, my voice rises slightly. I might talk a little bit faster. But it's like when I'm pacing and everything else, it's like that's what happened to me. I was having a reaction to medication. Of course, at that time, they were trying to have me on a bipolar medication. And as I said, I'm not bipolar, so it didn't work on me correctly. Side effects are part and parcel of any medication. And when they're testing, that's the wrong word for it. When they're trying a new medication on you to see if it will help your symptoms, unexpected things can happen. Okay? Oh yeah, it's like something to bring up as well. It's like on certain mental health medications, I don't know why they've explained it to me. I've never really understood it. Grapefruit does not mix certain foods, certain drinks, alcohol, etc. Do not mix them with your medication. Grapefruit is one of those things you can die. Okay? Mixing alcohol or other recreational drugs with your medication is not a good thing. It reacts with your medication in your body and will cause things to happen. As in, quite often, death. There's other things that can happen as well where it can make you worse. It can have a certain reaction in your system where you have a complete psychotic break and so forth. Take your medication, follow a regular schedule during a day, avoid certain foods. The doctor will tell you, list them out, ask them specifically if you're not sure, and do not take recreational drugs, do not take alcohol while you're on your mental health medications. Okay, guys? That's vitally important. It's called, when you take recreational drugs, alcohol, and so forth, you're self medicating. You know your body's right. Subliminally, you know your body's not acting right. So your body tries to do different things to help yourself, help you regulate your symptoms, try to get you back on track. Okay, sadly, that's enough for today. I'll talk more about different side effects of medication and mental health disabilities later on. Okay, guys. I hope this helps somebody today. This is my third round on this. Let's see if y'all like what you're hearing. Stephen from Arkansas, signing off. Good luck, guys. Bye.